What would be left of you if you could no longer make new memories? So Clive Wearing, who we saw last time we were introduced to him, forces us to confront that question. But his case also points us to an even bigger question, which is why do some experiences become lasting memories while others disappear almost immediately? So, to begin with today, we are going to finish up our look at the case of Clive Wearing, and then we are going to turn our focus to encoding and retrieval, starting with the implications that types of encoding have for long term memory. So, hopefully, in your long term memory, you can remember this guy. So, that's Clive Wearing, and that's his wife, Deborah. And as we saw last time, Clive Wearing, through a virus infection, developed anterior grade and retrograde amnesia. So, anterior grade, Clive cannot form new memories. So, since the accident has occurred, he has not been able to form new memories. And also, he cannot remember anything before the accident. He literally lives in the now. He is the most present in the moment person possible because for him, there's no past to distract him and there's no future to dream about. It's just existing at that particular time. And then we saw an excerpt from Deborah Waring's book, Forever Today. And we are going to meet the person mentioned in this excerpt today. So the saddest answer came when Barbara asked him to name all the composers he could think of. We're going to meet Barbara today. He could name only four in the space of 1 minute: Mozart, Beethoven, Bach, and Haydn, the composers he would have known best in childhood. After 25 years faithfully studying the life and work of Orlandus Lassus, even that escaped him. So we can see here that some of his semantic memory, actually much of his semantic memory, is intact. So he remembers Mozart, he remembers Beethoven, Bach, and Haydn, but much of his semantic memory is gone. And his episodic memory, his memory of what happened to him, is absolutely completely gone. So without further ado, let us now take a look at the conclusion of this look at Clive Wearing. And also, I will comment a little bit when Barbara is doing studies on him, what exactly she is trying to test with the study that she does in this video.
We try to train the staff so that they don't ask Clive questions or begin discussions which put a load on his memory. For example, if you ask Clive, "How are you today?" There's an implicit demand on, "Well, I'm better today than I was yesterday." And he gets quite upset, and we will then start to talk about how he's been ill and how he can see and hear for the first time. So what we do is talk about the here and now. We ask him if he'd like a coffee. We enter into conversation, and Clive is still an excellent conversationalist, but it's all about current events. It's about the surroundings. So we might comment on all the sun shining out of the window, but we wouldn't say, "Oh, it's a nice day today," because that implies that he knows what day it is and he knows what the weather was like yesterday, and so on. So we have to try to be careful not to place those demands on his memory, because he then does become upset, and we want him to have a calm and content life.
Oh, say you. What have you got there?
I brought you some case.
Oh, I had to say it was just. I'll leave better than it. I see it. I'd go along with that. Oh,
Would you like a Danish pastry? Would you like one?
I would actually. Got enough to this.
One each. You and Mike.
Well, thank you very much. Very, very large, aren't they? So, thank you.
Thank you. Take one.
This is enormous. That thing was a hole.
Well, how would I get
Oh, that's you that.
make it easy?
That sounds like a male name. Serviette. Okay.
No.
Is he big? Sir.
One of the things that characterizes Clive's day is that he continually makes entries in his diary. And I say makes entries in his diary rather than keeps a diary, because in fact he's not keeping the diary. It is an inner compulsion to record the momentous event of waking up, because Clive's perception of his own condition is that because he has no memory whatsoever up to the current 10, 20 seconds, or maybe half a minute, depending on whether there have been distractors, any proactive interference. On the whole, his conscious working span memory is that current minute. So everything else behind the minute is blank. So everything until now is an unknown and is void. So he uses the analogy of feeling as if he has just woken up. He says it's like just waking up for the first time. It's like just becoming conscious. It's as if I have been unconscious for however many years. And because this is a continual state, unless he's actually engaged on a conversation or on playing patience to solitaire, which he does a lot, or on playing the piano or on taking a walk, unless his mind is elsewhere engaged, that is his experience of life, which is, oh, it's as if I've just woken up. Oh, you're the first person I've seen. Oh, I am, and it's this amazement that from, I mean, can you imagine what would it be like if you were unconscious and you just came to, but you didn't have a lot of people around your bed saying, oh, you've been unconscious, you're in hospital. You've just got people eating a meal or watching TV as if nothing has happened. So he is habituated to that condition. He realizes that it's not surprising, but he uses that as an analogy for the experience of having no memory. It's as if I've just woken up. And because for him it is momentous, he has to write it down, and he has to write it down on any available surface. If the diary is in front of him, he will write it down there.
So just real quick, just another observation from Deborah in terms of the different kinds of memory. And again, this is that functional dissociation. Clive cannot form certain new memories, but he definitely can form other new memories. So the ability to remember that he has been awake before, that's gone, right? The ability to remember that he has been conscious before, that's completely gone. But notice that she said that he habituated to the fact that people aren't surprised that he's woken up for the first time. Because it should be like coming out of a coma. You should have people around your bed. You should have them ecstatic and crying that you have finally come to. And for him, he has enough knowledge to know, well, that's what should be happening here. But then after just trial after trial after trial after trial of that not occurring, he has habituated to the idea that, well, this is the new normal. This is the normal thing that people do when somebody is awake for the first time. And you can't do that without some implicit memory being formed. So the fact that he has habituated to it now and just is conscious for the first time and looks around and says, all right, people are eating, I get it. That has to be a new memory, an implicit memory, because again, he's not explicitly aware of it, but it's just this feeling that he has that, yeah, this is pretty typical reactions.
He will record the time, 10:50 a.m., awake first time, 10, and then he looks at the previous entry, which was 10:48 a.m., awake first time, and he says, no, I wasn't awake then. That wasn't me. That wasn't proper awakeness. This is the first real awakeness. So he goes through the diary, scoring out previous entries and underlining the current new entry, because this now is the real awakeness. All the previous awakenesses are unknown to me. So what he's saying something about ego. He's saying something about identity. He's saying, I know now. I know this moment now. I have no conscious recollection of those previous entries in my handwriting, though I acknowledge obviously they were me. Therefore, this is the real awakeness, and you had to take notice of that. So he'll underline it many times. And what's interesting is that over the years, as the diaries have stacked up, the pages have become written in a more and more frenzied way, as if to say it's really important you take notice of this. Just as a prisoner has to scratch the fact of his existence on the prison cell wall. I was here today, and I'm alive now. The world, you have to know this. That's what Clive is doing with his diary. And I think he's actually telling us something quite important about his perception of his condition. And he is the best eyewitness for his condition.
So again, I'm not really sure what the sort of memory system would be specifically for the change that we see in the diary entries. But again, the fact that the diary entries have changed, they become more frantic over time, means that some sort of information has been stored in Clive's mind. He might not be able to access it because, again, he's like, well, I've never written a diary before. These entries, they're not my entries. He can't remember explicitly writing them. But again, the fact that his writing has changed and the style of his writing has changed means that some sort of either procedural memory or conditioning memory has occurred that has allowed that change to happen.
Because
I've nothing to say about it. It's just like death. No thoughts of any kind, no dreams, no difference between day and night, no sight, no sound, no taste, no touch, no smell, exactly like death. No difference between day and night. No thoughts, nothing. No dreams, nothing at all. Any question you'd have is to answer, I don't know. There's nothing to say. No dreams, no sight, no sound, no taste, no touch, no smell, nothing at all, no thoughts, nothing.
All right. And that is another great example. I'll let it play for a while after this, but when you kind of break down what he's doing, there are so many examples, and you can see how pervasive memory is in our daily experience and in our daily behavior. So what we just saw, the speed at which Clive was talking about his condition, that is an excellent example of implicit memory of priming. So in a typical person, if this was the first time that you've woken up and you have never tasted, never seen, never touched anything before, you would sit there and you would be explaining to this person and you would say, it's just like death. You know, there's no sight. There's no sound. There's no touch, right? I've never tasted anything. I've never smelled anything, right? That's how you would do it. If you saw how Clive was doing it, he probably did that early on in his condition. But as he kept saying that over and over and over again, if you watch those two, they're exactly the same. No sight, no sound, no taste, no touch, no smell. I don't know how to explain it. It's like death. No sight, no sound, no taste, no touch, no smell. It's fast because no sight primes no touch primes no taste primes no smell primes no sound. Each of those primes the next one in the link, and that's an example of implicit memory. And again, that explains why he can rattle that off so quickly.
this, how long ago?
2 years, that's all I know. Whole time I've been ill, nothing at all, no thoughts, nothing.
What's it like now?
I can see. First time I had any evidence I was alive.
And do you feel sort of normal now?
Yes. Since I sat down here, I don't remember sitting down then.
You don't remember sitting down?
No, I never see any human being now. I can see you fully over now. No touch, no smell, nothing at all.
Do you know what happened to you?
No.
Any idea?
No idea at all. Just like that.
Do you know how long you've been on?
No idea, just keep 5 years, that's all.
When do you, any idea what year you got ill?
No.
Have a guess.
Sometime in the 80s.
Sometime in the 80s, yeah.
All that.
Early 80s, mid 80s, late 80s. Guess?
Middle 80s.
Middle 80s, yeah. That's correct. And do you know what year it is now?
No.
Have a guess.
I was in the 90s, I suppose.
Yeah, how far in would you say?
Anything between 91 and 99, I don't know.
You've no feeling for that. But it's now 1998. Any idea what month it is? All right, have a look out the window.
No, it looks like that March, April. February, March, I don't know. Okay.
It is April. You're very close time, yeah. So whose birthday is it next month?
Mine.
Yeah.
And my boat.
Any idea how old you'll be?
93,000.
How old do you think really?
21.
How old do you really think? How old do you feel?
22.
You feel 22, and how old do you think you are?
67.
No.
No?
You really think? Do you really think it's?
I have no idea what this is. It could be 90 or 100, all I know, though. No difference. Day and night, no dreams, nothing at all.
Do you think your hair's grey or
No, I've
white?
never seen you.
It is perfectly okay to guess. Neuropsychologist Barbara Wilson has evaluated Clive's cognitive functions on 15 occasions since 1985.
Door. This is another front door. This is a stable door. Front door. Stable door. And a garage door.
Such a taken in Cambridge, Sally. Okay. So one of those doors, Mr. Waring, you saw just now. You willing to have a guess?
No, not at all. I can't remember anything. It's just like being dead where I had. I've never seen anything. You're just flipping over so fast I can't remember a thing.
Get anyone not more familiar?
No. They're all equal as if they're different. I have no idea what I was looking at just now. It's a waste of time.
Which one's most
I've been told none of them. None of them at all. I can't remember what happened. My brain is not working enough.
Was there a page restricted? Can you see?
Okay, so that's Barbara. She is doing some psychological tests, and the technique that she's using right now, she's trying to test his recall. So she's showing him different doors and then asking him, which of these 4 did you previously see? And Clive is saying, I don't remember. I don't know. I don't have any explicit knowledge of that. And then what she's trying to do is she's trying to probe to see, does he have any information encoded? Has anything gotten through? And that's why she first asks him, well, just guess, right? Just guess. And the idea is that if he has any memory, but it's not quite reaching the criterion where you are comfortable in saying, yes, I remember that I saw that one. If you say, well, just guess at one of them, just point at one of them, then that brings that criteria down. It allows people to just say, well, I don't really remember, but I think maybe it's, door number 3. And then what that does is if they choose that door at higher than chance levels, then that's an indication that they are remembering something. There is some encoding of information. There is some retrieval of information. When he wouldn't guess, she went to another strategy, which is, well, which one is more aesthetically pleasing? And she is leaning on the phenomenon that oftentimes what we see that is most familiar is most aesthetically pleasing. So if we're given 2 different paintings to judge on which one looks better to us, the one that is more familiar will typically be the one that most people will choose. So she was asking him, well, which one do you like the best? And again, if he pointed more often to the door that she had shown previously, that would also indicate that some encoding is going through, not necessarily explicit, but at least some implicit, just aesthetically pleasing, just fluency of processing the information. At least something is making it through.
Well, I think Clive Wearing is unique. I've never known another person so amnesic as Clive. And I've probably seen about 700 brain injured people, most of them with memory impairment. He's definitely the most amnesic person I've ever known. I think it's a very dramatic illustration, particularly to the public, of what it's like to be without memory. For example, this constant feeling that he's just woken up, or he hasn't tasted anything before. And even if he's seen his own writing in his diaries or videotapes of himself, he acknowledges that it's him on the video, or him conducting, or him writing, his handwriting, but he says he wasn't conscious then. And the fact that he must have been conscious to have written or conducted, he won't accept it. Now that's, I've never seen that in any other amnesic people, even people with a very dense amnesia. They don't say, I wasn't awake then, or I wasn't conscious then. So I feel that aspect of it is more than the memory impairment. I think it's also very striking how his musical skills are intact. As far as we know, we haven't been able to do a formal evaluation of his music. Some people interested in the neuropsychology of music have heard his tapes or seen videotapes of him playing. And it certainly seems that his his musical skills have not been affected by the illness. He may now be a little rusty and a bit slower because he's not practiced so much. So I think what that tells us about functioning of the brain is that what's been damaged in Clive are not the areas concerned with music. Another interesting aspect about his deficits now are that he has quite significant semantic memory impairments as well as episodic memory impairments. So not only does he forget things that had just happened or that he's just seen, but he has to some extent lost his general knowledge about things. He doesn't know, for example, if he sees a photograph of the Queen and the Duke of Edinburgh, he thinks they might have been in his choir. And it's very hard for him to tell you in any detail much information, even things he knew prior to the illness. He's been virtually unable to learn anything since the onset of the illness. And again, that's different from some amnesic people. There have been reports of a few who, despite a very severe episodic memory, have managed to learn new vocabulary, learn new acronyms like AIDS or whatever. And Clive, by and large, hasn't learned anything. We were talking earlier today about the new information that he has acquired since the onset of his illness. And we think there might be 4 or 5 things. He will, if questioned appropriately, tell you about the reunification of Germany, about Hong Kong going back to China, about the breakup of the Soviet Union. Although if you ask him directly whether these things have happened, he'll say, I don't know. But the way we can find out that he does have some knowledge of that is because he says things like, has Hong Kong gone back to China yet, if you start talking about Hong Kong. But it's very, very tiny little bits of information, given the extent that he watches television and he does get a daily newspaper.
Magnetic resonance.
All right. So just a treasure trove of functional dissociations just in that little synopsis of Clive's abilities from Barbara. So just a couple of things. Number one, what was it, 4 or 5 new pieces of information in 13 years, I believe, since his accident in that video. So that is massive anterior grade amnesia. But then also, very interestingly, and we haven't discussed this, so I'm just going to leave this out there for you to think about. But when we were talking about semantic knowledge, we said that this is knowledge for facts. This is knowledge for things that you know. And it looks like Clive has a huge impairment for much of his semantic knowledge. Like he didn't know certain royal figures. He thought they were part of his choir. And yet at the same time, he knows what a choir is. And he knows what a piano is. And he knows what clothes are because he can get himself dressed. And he knew to call a cup of coffee in the previous class that we had. When he saw a cup of coffee, he's like, oh, I've never had coffee before. He didn't say, oh, I've never had this black liquid here before. He knew it was coffee. He knew it was a coffee mug. He knew there was a saucer and how to use it. So there seems to be 2 different types of semantic memory. One for, I don't even know how to label it. One for almost factual information, and then one for real world functional information, like things that you know how to use rather than things that you just know of. But again, those are the kind of things that somebody like Clive Wearing and studying Clive Wearing can tell us that there has to be that difference between those 2 types of memory, and they're represented different in your mind and implemented differently in different areas of your brain.
Resonance imaging scans of Clive's brain were done in England in 1991. Dr. Aaron Bigler of Brigham Young University recently examined and interpreted these scans to correlate them with Clive's cognitive abilities and deficits.
In this 3-dimensional reconstruction of the brain from an MRI in this subject, what we've done is we've colorized the surface of the brain here in this flesh tone. And you can see the Sylvian fissure here very clearly. That divides the frontal lobe from the temporal lobe. And then we make this cut across at about this level here. And that allows us to look face on to the subject in this view right here. This is the coronal view. And so there's the Sylvian fissure. There is a healthy temporal lobe down in this region right here. This is where the hippocampus and the amygdala reside. If we now look at Clive's scan, we see an extensive area of missing brain tissue. There is no brain tissue there. That is filled with cerebral spinal fluid. There's a small remnant of the superior temporal gyrus of the temporal lobe. Everything else is gone on the left side. On the right side, we have extensive wasting also of the mesial temporal lobe, but some of the lateral temporal lobe remains on the right side. It is of interest that he has retained the musical abilities that he has. Some musical abilities may be more dependent on right temporal function. Also notice the extensive enlargement of the ventricular system. These are the anterior horns of the lateral ventricle. Here's the size that they should appear. This very small area is a more normal size of this part of the lateral ventricles. The enlargement is associated with a massive loss of brain substance spread throughout the brain, not just the temporal and inferior frontal damage, but there's been some generalized loss of tissue. You can see that also when you look at a lateral view of the brain. Here's a normal lateral view or sagittal cut, and this structure right at midline is called the corpus callosum. And that's what a healthy corpus callosum looks like. This structure that wraps around right here, this is the fornix. And the fornix is a critical structure for the projection of memory information from the hippocampus. When we look here in Clive, we see that the corpus callosum is smaller in size, and there's only a little remnant of the fornix left. And that is because there is massive damage to the hippocampus, essentially complete wasting of the hippocampus on the left and almost complete wasting of the hippocampus on the right. Another view that we can look at to examine the type of damage present in this patient is the axial view. And this is taken in the horizontal plane where we cut across like this, and we're looking at the inferior part of the frontal lobe. And in this view right here, we have made that section. This is a normal subject, and pay particular attention to this region here. And this is the mesial part of the temporal lobe where all of the damage has occurred in Clive. The infection process spreads in this region. And if we now look at his scan, we can see the extensive damage on the left, as I mentioned. See, this is the left side of the brain here. Extensive damage to the mesial part of the right. And then here is the inferior frontal damage in this patient. That's at the posterior part of the inferior frontal region. Now, this particular region of the brain is important in regulatory aspects of behavior. And some of the discontrol that this patient has, especially the emotional lability and changes that occur, are undoubtedly related to the damage at the temporal lobe level, but also this involvement at the inferior frontal region of the brain. What I'd like to do now is also show these various two-dimensional images now in three-dimensional space. And we can do that by taking each plane and putting it in the proper position with the other planes. And this is seen in this three-dimensional lattice work type array that is on the computer monitor now. And so these vertical lines here, they represent the coronal sections that have been cut across like this. These horizontal lines here represent the axial views that have been cut across like so. And then we also have the mid-sagittal view that's right at midline here. And see, there's the nose and there's the mouth. And now we're going to rotate this and see, we'll rotate the head. You can see the ears out here. There's the nose, and here are the ears. Now we can cut back. And so we'll now cut back and expose the damage. And what we've done here is we've colorized the damage in red to show how extensive wasting has occurred in the temporal lobe region. And now we can rotate this image, and you'll see the extensive amount of pathology that is present. Again, the greatest amount of loss of tissue is on the left side in the left temporal region, but the damage is obviously bilaterally represented, as you can see here. And as we turn this around and look towards the back, again, this dark area here, that represents the wasting of the brain in the temporal lobe region. As we tilt the scan back, you can also see where the damage is in the inferior frontal region of the brain. And it's the combination of this inferior frontal damage and the bilateral temporal lobe damage that then represents the deficits that we see in this patient that are primarily manifested as a profound loss of any short-term memory and the emotional lability and discontrol evident.
I think when most people come across Clive for the first time, or if they would read his neuropsychological test scores, if they would look at his case history, they would assume that he has a virtually total loss of short-term memory, and because he has to live looked after 24 hours a day, they would assume that there's nothing much left of him inside. In fact, there's a lot left of him inside. There's a lot going on in there which tests are not sensitive to. He remains a very intelligent and lucid and articulate person, and the deficits he has are very specific, and they don't affect him in a general way. They affect particular kinds of memory function. Therefore, although he has no conscious memory of anything that's happened since he was ill, he has no episodic memory for the whole of his life. In any amount of testing, he's never managed to produce a single episodic memory. And in all his exposure to me, I'd never witnessed any episodic memory. Nevertheless, he retains an intelligent semantic memory about his life. He knows that he worked for the BBC. He knows that he was a conductor. He knows that he's married to me. He knows that he has children from a prior marriage. He just doesn't know the details, and he can't bring those things to mind. Now, the interesting thing is that even though on a minute-to-minute basis, he is forgetting everything that happens, he perceives the world around him as you or I would, but everything is erased immediately afterwards. And so moment to moment, he forgets exactly what's just happened. But he does show signs of implicit learning. For example, when he's been watching a video, the same video every day, he now anticipates what is going to happen on the video, although he has no conscious recollection of ever having seen the video before. In other words, learning is going on at a procedural level, at an implicit level, at a non-declarative level, and it is not open to his conscious inspection. He can't, if asked, do you know anything about it? No, never seen it before in my life. But it's there and he can use it. And that's what's helping him now, 13 years post-injury. It's helping him to function as an articulate and communicative human being. As a companion, we have very meaningful conversations, whereas for the first 7 years, we had 3 short loop tape conversations verbatim, repeated verbatim, with the same inflections, the same intonation, the same expressions on his face, so much so that after having the same conversation for 7 years, I couldn't hear what he was saying any longer. Now I can phone him up and say, do you know what happened at work today? And I can have a very ordinary conversation, and he responds, he listens, he follows the train of thought, and he gives me really good advice.
All right, so we'll end it there because that was like a really nice synopsis of everything that Clive is able to do and and various of his impairments. One thing that I will point out in terms of a person with typical functioning long-term memory, you can tell Deborah has been researching and reading up and doing her homework on memory and Clive's condition. Because if you compare her in the first part of the video, when it was early in um, Clive's condition, she was talking about things where, he has, he barely has any memory, but he remembers he loves me because it's raw emotion. It's just the raw thing that he remembers. She was talking about it in very non-academic terms, but now she's just like, well, he's got episodic memory and he's got procedural memory, and you can see that some sort of implicit learning is. So you can tell she's been doing her work on this. Although it did surprise me a little bit, and this could be another version of conditioning that Clive has gone through, and the fact that there is so much association between Deborah and the characteristics of Deborah and positive emotion, right? Deborah goes with positive emotion. He loves Deborah, so Deborah has been massively associated with positive emotion. What that means is that when he sees her or when he hears her voice, he's already put into a good mood. He already has that positive emotion through conditioning, which is probably why staff cannot ask him, oh, it's a nice day today, because again, that will make him upset, because that implies that he can remember what happened the previous day and compare what is going on today to the previous day. So they'll get upset because of that task on his memory. But she mentioned that she is able to have really nice conversations with him now, and she can phone him up and say, do you know what happened at work today? And he's fine with it, because the positive emotion that has been conditioned into his mind through just the positive experiences that he's had with Deborah buys her a lot of leeway in terms of him not getting agitated at that particular behavior that would cause a negative reaction with other individuals. All right, and then before we move on to encoding, I just wanted to pause on something just a little bit bigger than just the memory impairment, because Clive's case is really fascinating, not just because it tells us, semantic memory, episodic memory, procedural memory, these are all different things, but it does force you to ask, what makes somebody the same person across time? Because we just saw Deborah insist that Clive is still Clive. There's still that interior him inside, even though he's lost the ability to form new episodic memories, even though he can't remember who he is. So psychologically, what would you think is left of yourself if you were to strip away all memory? So are there any aspects of Clive as a person that are now missing? And take a second to think about this. What is still there for Clive as a person, and what would you think might be missing from the way that he used to be?
Maybe like his like this baby has some like personality, like maybe different from like those who, but maybe it worked all the time. They're getting there.
Okay, so his personality might have changed because of his loss of episodic memories. Any, for examples or speculations about? I mean, we don't have access to it, but what might a change like that look like?
Um, in these small conversations, they were more like having yes, she kind of like question. Those question.
Mm-hmm. So there does. It sounds like you're alluding to the idea that there seems to be this core Clydeness that has survived. And then in the initial stages, the loss of memory and the loss of that ability was a massive stressor. And that stress, just like any of us, when we're under stress, we're not ourselves, right? We literally have that in our vocabulary, and we say that. It's like, oh man, I'm sorry about last weekend. I wasn't myself, right? So Clive, this is a massive stressor. So for years, probably wasn't himself. But the fact that Deborah, at the very least, said, oh yeah, we got back, to the way that things were before. Like we can now have these conversations again, very heavily implies that there is this Cliveness that was maintained. And then once the sort of stress, he was able to cope with it, that came back to the surface, and he was able to behave in a manner that he used to behave. Any other speculations about that? Yep.
I think it's all to do with implicit memory and the things that we unconsciously know about ourselves that we kind of learned. Like, for example, the fact that he was married. Like, he didn't actually learn that. He just knew that was a thing about him. Or the fact that he had children. Or that he played the piano, it was a musician and conductor. Those were all, you keep saying quietness. Those were all central Cliveness things that, he did or experienced every day. Such that it was all kind of procedural to him. Like it was just there in his mind, and he didn't have to really learn those things.
Okay, so a lot of what is him seems to be coming out in implicit memory. Do you think that applies to people in general?
I would say so.
Mm-hmm. And then what would that imply about changing something fundamental about yourself?
I think it implies that it takes a lot of time and repetition, because it's not an arbitrary thing you can just pick up and learn on a day. It's not like learning how to play a new card game or something. And it's like a reprogramming of your brain almost.
Mm-hmm. Yeah. So that's a very good point. One of the things that Clive his condition kind of shows us is how much of you remains when your semantic knowledge is gone, when your episodic memory is gone. You are still very much the same person that you are today, which means that a lot of who we are is implicit. It's implicit learning, it's implicit memory. That's what determines a lot of how we act, how we react, how we engage with the world. And that's a great thing, because if you had to think about every action that you needed to do, if you had to make a decision in the moment for everything that you ever needed to do, you would literally, your mind would probably explode, right? So what I just described is like the definition of overthinking things. And when was the last time somebody came up to you and said, oh, you know what, you're overthinking things, and that was a good thing, right? Nobody ever goes to you and says, hey, great, presentation today. You were really overthinking things, right? No, it's always the opposite. It's always you fumbling. It's always because a lot of our behavior is really, really automatic. So the fact that Clive has lost almost all episodic and semantic memory, or much of his semantic, all of his episodic, means that some core being of ourselves is that implicit memory, is that implicit learning, which is one of the reasons why, if you want to change core aspects of your being, so for example, if you are dealing with mental health difficulties because of implicit learning that has occurred throughout your life, number one, know that it's going to take time to reprogram your mind. And also it's going to be difficult. So definitely get yourself some help. All right. So, so that is the case of Clive, and his case pushes us to a major cognitive question, and that is whether or not memory is something that yourself has, or is it a fundamental part of what yourself is. And just as a sort of mind experiment that you can indulge in, we won't do it right now, but think about this. What if it was reversed? What if Clive Wearing lost all procedural, all conditioning, all priming memory? but his episodic memory fully intact, his semantic memory fully intact. So just to give you an example of what that would mean, Deborah walks through the door, and instead of him breaking out into song and giving her a hug and kissing her, he's like, "Oh, hello, you are my wife, and I remember you." And that's it. How much different would it be in terms of his lived experience if that was a memory loss? All right, so speculate on that, but we are now going to turn from long-term memory structure, what memory looks like, and what memory looks like when the system breaks. And now we're going to ask the next question, which is when memory works normally, what actually determines whether an experience will last, whether that memory will last? Because thankfully, not everything you encounter becomes a long-term memory. Some of it disappears almost immediately. Some of it will last for years. And one of the cognitive psychology deep questions is what determines that? And as we're going to see today, it might depend on how deeply that information was processed when you first encountered it. So that is what we're going to be looking at for the remainder of today. We're going to start our look at encoding and just kind of give you a teaser of what is coming up. When we take a look at encoding and when we take a look at retrieval, this is going to be the prequel to the cutest lecture that I give. So get ready for babies and more babies and even more babies and much more babies. And one of the interesting things that we are going to tackle, not today, but we're going to start building the pieces for that, is why do you not remember your first 3 years? Why are these mostly wonderful experiences just gone? And how can we explain the fact that there is clearly some memories that babies are forming, but there is no recollection of what they were from about 0 to 3 years old? So we're not going to take that today, but we are going to start building the blocks that we need to tackle that question. But today we are going to take a look at encoding by taking a look at the levels of processing theory and your 8th Cog Lab, the levels of processing. So to kind of contrast levels of processing theory, we're just really going to quickly take a look at a structural theory. And a structural theory of memory has the idea that memory can be divided into different structures. So you have a short-term memory structure, and its structure is what determines the fact that it's short-term. You have a working memory structure, and its structure is what determines the fact that you can hold memories while you're working with them. You have a long-term memory structure, and its structure is what determines that a memory will last for the long term. So if you're asking, will an item be recalled? It completely depends on the memory structure. So if it's in the short-term memory, probably not. If it made its way into long-term memory structure, yes, it will be recalled. It depends upon, according to structural theory, it depends upon which structure of memory has that information been encoded into. So one of the more famous memory structure theories was Broadbent's model of memory. And I like this model partially because I think that's one of the best photos of a psychologist that I've ever seen. He kind of just looks like he does not give stuff at all. But anyways, Broadbent's model is one of the classic structural models. So in his model, you have information. Information is coming into your 5 senses. And then that information goes into different structures. So you have your primary memory, and your primary memory starts with the S system, and that is your sensory system. And that is the sort of echo that your senses give you when you are encoding information. And the easiest example of this is if you've ever gotten a flash in your eye when somebody took a photograph, and then you can kind of see the flash because it's been imprinted on your retina. That's kind of the clearest example of the S system. So it's a type of memory, right? Because you remember the flash has occurred because it's still affecting your receptors. But then from that S system, it goes into the P system. And the P system is like the working memory, short-term memory system. And if you can go from that P system into your secondary memory, then you'll be able to store things long-term. So in this case, we have 3 different structures of memory, and the S system lasts for milliseconds. The P system, that's your short-term memory. The secondary memory, that's your long-term memory. And whether or not you remember information that was encoded depends upon which structure it's actually in. So that's a structural model. On the other hand, there have been models that have been proposed that are processing models, not structural models. And what they propose is that memory and whether or not something is going to be recalled is the result of different levels of processing, not structure, but processing. And this affects how the information is encoded. So how you process it impacts how it's encoded. And then it also impacts how it will be retrieved. And if you're asking, will an item be recalled? The dependent factor, the critical factor is not a structure that it resides in. It's what type of processing did that information receive when it was encoded. So the first people to propose this model was Craig and Lockhart. So we're going to take a look at their levels of processing framework. But before we get into the details of it, I want to make this a little bit more practical, just kind of lay a foundation for this. So just as a kind of exercise, think about the last week of your life. All right, so think about from today all the way back to the previous Thursday. You encountered and encoded and processed tons of information, thousands of things, and most of them are gone, but a few of them will remain. So take a second and think about maybe 3 things that you still remember clearly. Like think about your last week. What are 3 memories that just kind of come into your mind and you're like, oh yeah, I remember that, and I remember that, and I remember that. And try to think about what is common among those memories. So not so much maybe the content of them, all right? So don't feel like you need to divulge secrets in terms of the content, but is there anything that's common amongst those pieces of information that you remember? All right, so has everybody 3 things that you remember from the last week? Okay, good enough. Okay, so let me ask you this. Are all 3 of those pieces of information highly meaningful, or are they trivial? All right, so just kind of mentally note, are these things that were meaningful, or are they things that were trivial? Are these things that had maybe emotional significance to you, or are they things that produced no emotion at all? And then are these things that are connected to something that you already knew, or were they completely new pieces of information? And then also think, was it something that you interpreted, or was it just something that you noticed? That is, did you think about it? Did you ruminate on it a little bit? Or was it just something that occurred and you thought to yourself, oh, okay, and then moved on? So think about those questions, because that is all examples of different types of processing. Whether something grabbed your attention because it was emotional, whether it got tied to something that you already knew, linked to something that you already knew, whether you thought about something and interpreted it, or you just noticed it. Those are all things that determine different amounts of processing. And as we're going to see now in Craig and Lockhart's work, processing tries to explain why things are remembered versus why things are forgot. All right. So this is a table from the article. And in this table, they have on the left there in that left column, they have different features of your memory. What is the capacity? What is the way that the memory is entered all the way at the bottom? What is the trace duration? What is the type of retrieval? The next column over, we have sensory registers. The third column from the left, we have short-term store. And in the fourth column, we have the long-term store. So the sensory registers, those are that kind of echo in your sensory systems. So we're going to focus on the short-term store and the long-term store. So they've listed a whole bunch of features for the short-term store, and they've listed a whole bunch of features for the long-term store. And two of the things in the short-term store have to do with capacity and trace duration. So we have a capacity that is small, and we have your trace duration of up to about 30 seconds. Notice this meshes really well with Clive Wearing's experience of that 30-second window. So his short-term store seems to be intact. So it's small and it's up to 30 seconds. So it's small and it's short. It's a short-term store. Okay, so we would expect that if your short-term store, if the structure of it was actually what was causing the short-term store, we would expect it to be small and we would expect it to be short. For the long-term store, the capacity, no known limit, and the trace duration, minutes to years, and that is what is your long-term store. So the structural theories would say that the reason that a memory or memory capacity is small and the duration of it is short is because that information is in the short-term store. And the reason that your memory has no known limit and you can remember things minutes to years is because that information is in the long-term store. Well, what Craig and Lockhart pointed out was that there are other features in the short-term store that are not shared by the long-term store. So for example, if you take a look at how the information is maintained, in your short-term store, it tends to be rehearsal. And if you take a look at the format of the information, in your short-term store, it tends to be phonemic. It tends to be the sound. So the clearest example of this is if you're trying to remember somebody's phone number that they just gave to you and you don't have your phone out to take the note, right? And they say, oh, it's, 555-834-287. You're going to start rehearsing that. You're going to start saying to yourself, 555-834-27, 555-834-247, right? And it's a kind of phonemic sound internal monologue that you do. That's going to be very short-term store. But if you take a look at the long-term store, what about its maintenance of information? Well, its maintenance of information occurs because of organization. Your information is organized in a way that is structured, and we're going to see this when we take a look at conceptual knowledge, organized in a way that links to other parts of your memory, and it's largely semantic. Many things in your long-term store have to do with the meaning of things, have to do with what something is and what something, what these things mean and what are the implications of it. And this idea of the maintenance of information and the format of information, notice that they're different. Things that are not recalled for very long and have a very short capacity, those things are typically rehearsed and they're phonemically formatted. Things that are remembered for long times, those things are typically organized and they're semantically formatted. So we don't necessarily need a short-term memory and a long-term memory to understand why some things are remembered in the short term and why things are remembered in the long term. Craig and Lockhart said, well, what is actually going on is the maintenance of information and the formatting of information. That's what determines how long memories last. If you only rehearse things and you format that information in your mind phonemically, sound-based, that's going to be a short-term memory. And if you organize your information and you encode that or you format that information semantically, that's going to be a long-term memory. So it's not the structures, it's the way that the information was encoded. So that was their theory. So let's take a look at some more details of their theory. So Craig and Lockhart in 1972, they proposed that the type of processing is what is actually important to memory. and they had a few assumptions in their theory. Their assumption number one, memory is the result of a series of processes. And this series forms a continuum all the way from really shallow processing. So for example, just processing the perceptual features of the information that you are processing, all the way up to really deep processing, where you process the meaning of a particular piece of information. So for example, if you have this piece of information, shallow processing would be something that just processes the features of the information, such as how many vowels are in this word. And you would take a look at it and you would say, okay, we got 1, 2, 3, 3 vowels are in this word. I have processed this information, but I've done it at a very shallow level. If, on the other hand, I ask myself, is this thing alive? Now I have to process it deeper. I got to pull out the meaning of the word. I got to say, well, yes, that's an elephant. Elephants are alive. So yes, this thing is alive. If you ask the same questions here, umbrella, deep processing, is it alive? No, umbrellas are inanimate objects. Shallow processing, features of it, how many vowels, 1, 2, 3, that would be shallow processing. And importantly, the levels of processing, according to Craik and Lockhart, that's what determines retention. So if you process something shallowly, then you're going to have poor retention. It's going to look like it's in the short-term memory structure, but it's really just a short-term memory because you processed it so shallowly. But if you process something deeply, you're going to have much better retention. So you will remember elephant and umbrella very poorly if all I asked you to do was to count the vowels. But you will remember this much more longly, much better if you were to ask, what are these things? Elephant is alive, umbrella is not alive. Now, assumption number 3, this one was really interesting. This was the idea that rehearsal doesn't directly help memory because it is one of our go-to strategies for trying to remember something. So you get, again, somebody gives you your phone number, you just start repeating that phone number over and over and over again. If you want to learn somebody's name, you want to remember somebody's name, you just met them at a party, you might say to yourself, okay, David, 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 David. And then you might do that thing where you just keep using their name repetitiously. You say, well, that's an interesting story, David. When did that happen to you, David? Tell me more, David. I'd love to hear more about your life, David. That's the kind of rehearsal that we go to. That's one of our go-to strategies. What they're saying is that it doesn't help your memory unless it induces a deeper analysis. So unless the repetition, just by virtue of the repetition, you start to deeply process the information, that is an indirect help. So for example, if you were sitting here and you're like, okay, I got to remember elephant and umbrella. So I'm just going to sit here, elephant, umbrella, elephant, umbrella, elephant, umbrella, elephant, umbrella, elephant. Hey, you know what? Elephants are pretty big things, right? Something that's impossible to ignore. So elephant has this, metaphorical, it's a metaphor for a giant size object. But at the same time, umbrella is also a metaphor, like an umbrella company, an umbrella term, something that covers everything. So umbrellas and elephants actually have that in common. If your repetition induced that kind of an analysis where you start linking and deeply processing, that's what actually is the mechanism that increases your memory. So last one, assumption 4, to study memory, you need to control the processing. So this one was a very important advancement in terms of being able to tease out certain aspects of memory. So there is a 2x2 matrix of learning and recall, or learning and testing, that you can manipulate to determine what type of encoding and what type of retrieving is actually occurring. So here are the 4 different types. So we have implicit learning. So this is the encoding portion of memory. Remember, memory, you need to encode and then you need to retrieve. In implicit learning, that is implicit encoding. Explicit learning, explicit encoding. Implicit testing, implicit retrieval. Explicit testing, explicit retrieval. So what does that actually mean? Implicit learning is when the subject is unaware that they are learning the material, meaning that they are unaware that this is part of a memory test. So if somebody ever gives you, I'm trying to think of a real world situation. If you are ever in a conversation with somebody and they suspect that you're not paying attention, and then all of a sudden they say, "What did I just say?" And you're like, "Well, what do you mean?" And you're like, "Well, I was just talking about something. What did I just talk about?" And you're like, you were talking about that time when you were younger and you learned to ride a bike. And they're like, "That was 20 minutes ago," right? That is implicit learning. You are unaware that that was going to be on the test, right? Nobody says, "Hey, I'm going to have a conversation with you and you need to remember everything that I say," right? So that's implicit learning. It's when you're unaware that you're learning the material. A good person who is engaged and paying attention, they will implicitly learn. That's what conversation is about. But anyway, implicit learning, you're unaware that you're learning the material. Explicit learning, you are aware that you're learning the material. So all of you are engaging in explicit learning now. So this is you actively saying, "Hey, I'm going to try to remember this." So you are aware that you're learning this material. Implicit testing, the subject is unaware that they're being tested on the material. Explicit testing, the subject is aware that they're being tested on the material. So explicit testing is the easiest one to explain out of this. This is just when they say, "Hey, the stuff that you learned before, tell me what it was," right? In that conversation, "Oh, I was just talking about something. Tell me what I was talking about." That is explicit testing. You are aware that you are supposed to recall the stuff that you encoded before. Implicit testing is ways of testing the material without you being aware that you're being tested on the material. So for example, in the Clive Wearing case study, when Barbara came there and let's say that she showed Clive the doors. She said, "Well, here's one door, here's another door." And then she left the room for 5 minutes. And then she came back. And all she said is, "Hey, Clive, do you like this door?" Clive might take a look at the door and say, "Yeah, I kind of like that one." That would be an implicit test of learning because Clive doesn't know that he's being tested on the material. And yet we're testing to see whether he has memory or not. One example of implicit testing on a typical functioning individual would be if I had you read a list of words, and it was a list of, let's say, 40 words, and 10 of those words were animals, right? So you're reading all these words. It's like car, pig, book, street sign, elephant, right? So it's a whole bunch of list of words and 10 of them are animals. If I then come to you and I say, "Name 20 animals as fast as you can, go." You are being tested on whether you're going to be more likely to say the animals that were on the list than somebody who had not read the list. So if you're more likely to say pig and elephant because you just read pig and elephant, even though I did not say, "Tell me the names of the animals on the list," I just said, "Give me 20 animals, go." That's an implicit test. So you're unaware that you're recalling the material, but if it makes its way into your responses, that's an indication that you actually have learned it. That's an implicit test. So interestingly, any combination of that is possible. So you can have implicit learning and then have implicit testing. You don't know that you're learning and you're not aware that you're being tested. You can have implicit learning and explicit testing. That's the conversation that you weren't paying attention to, where you didn't know you were supposed to be learning the information. And then the person says, "You need to tell me what I just told you." You can have explicit learning, explicit testing. This is the situation here. You are learning information here. You're aware that you're learning. And then when you do the exam, it's not going to be a surprise, right? You're going to be like, "Oh, okay, this is explicit testing." And then finally, you can do explicit learning and implicit testing in terms of, I tell you that you need to memorize certain words on a list, but then I give you something that you think is unrelated like just tell me the names of 20 animals really fast, and you are not aware that you are being tested on the material, but the material makes its way in, that's explicit learning with implicit testing. All right, so I was going to do Cog Lab 8 today, but we have run a little bit longer than I had anticipated. So what we're going to do is we will stop it at this point. Let me see if I can put another baby up there. All right, so we're going to stop it at this point today. But I'm going to end with a question. We're going to do Cog Lab 8 next time, but I'm going to end it with a question that's pretty simple, but actually, really strange when you think about it. And that is, why do we have infantile amnesia? Look how happy that baby is. Wouldn't it be great if you could remember that time, right? So why can't we remember the first years of our lives? And there's a number of different possibilities. Possibilities are maybe the memories were never stored. Maybe little baby brains just can't form episodic memories, and they just can't form semantic memories. We need more brain development. Maybe those memories were created, but now they're inaccessible. So maybe they're lying somewhere in our brains, but we just can't seem to access them. So try to think about different possibilities of why we cannot remember what happened to us when we were 0 to 3. And as a sort of push to kind of help you think about that, try to think about things that might help you remember when you were a baby. So I'll give you one example. A lot of times people go really deep back into their memories when they smell food that was cooked for them when they were little. So you walk into a place where gingerbread cookies are being made, and all of a sudden you're like, oh, wow. You know what? I remember when my grandma used to make me gingerbread cookies when I was really little. I haven't thought about that in years. But the smell kind of just triggers that memory. Try to think about what else might possibly give us the ability to remember things that happened to us as a baby. And one final hint that I will give you this, and this one's it's a little bit of melancholy here, but think about, when was the last time that this happened to you? When was the last time a giant human picked you up, held you over their head? Because this used to happen all the time. When was the last time that happened to you, and what might that have in terms of implications for our memory? I will leave you with that, but we are done for today.